So this is my dog Finch. I'm just going to show you some physiotherapy. This is me checking the temperature of the heat pad and just applying it on the areas that I'm going to be massaging today over about 10-15 minutes. And this video is sped up as well, so you'll notice it's going super quick. But it's really important that you don't rush it and give them lots of treats to encourage relaxation. So we're starting with our first massage technique, which is stroking, also known as effleurage. We're starting at the distal part of the limb, which is the part that's furthest away from the body, and we're making our way up to the proximal part of the limb, which is the part that's closest to the body, and we are maintaining physical contact at all times. The pressure can be slowly increased as the massage progresses. We've then moved on to the back, still maintaining physical contact, and we are starting from head to tail, making sure we don't go directly over the spine, but just down the muscles either side. So we're now onto a forelimb, and we're doing exactly the same as what we did on the hind limb. So we're starting at the bottom, making our way up to the top with a stroking technique. So we're now moving on to kneading, also known as petrissage. And it's similar to how you would knead bread, so you're just grasping the roll of superficial skin, you're lifting it from underlying tissues, and then you're rolling it between your fingers and releasing. You can work in circular motions and just keep moving on to the next segments as you're going along. So the pressure that you can apply with this technique is either superficially or deeply for deep tissue treatment. This might be, for example, large muscle groups along the back or in the hind limbs. So this technique is really going to help stretch and mobilise the superficial tissue. So we're moving on now to the third technique, which is rubbing, also known as friction. And with this technique, you just want to use slightly curved but extended fingers and then just slide over small areas in circular motions. This technique is really going to help increase blood flow to the affected area and therefore promotes tissue oxygenation and nutrition by eliminating metabolites and toxins from the tissues. And to finish our massaging, we're going to go straight back to the first technique of stroking. This should always be performed after friction treatment. As you're going back to your stroking techniques, your pressure may have increased throughout the massaging. Just be careful not to apply too much pressure over bony areas. So we're now going on to therapeutic exercise, and we're going to start with passive range of motion. So here we're just flexing and extending the digits. We then move on to the hock, and you may have noticed that we started at the distal point of the limb and we're making our way up to the top of the limb. We then move on to the stifle, which is the knee. It's really important that you just hold that position for a couple of seconds between flexing and extending. We then move on to flexion and extension of the hip. It's quite a quick demonstration because Finch unfortunately didn't really like that part much, so we moved on to the forelimbs. It's really important that you don't push them too much. If they're in any pain or discomfort, you stop straight away. And if they're just generally not enjoying it, then just stop. It's meant to be fun and relaxing for them. We're then going to move on to some stretching. And we're going to move the limbs gently in a bicycle motion. So this exercise is great at improving joint range of motion in neurological patients, since you're stimulating or reminding all of the musculoskeletal tissues how they work together as one unit. You're then going to give the toes a little pinch, which just initiates a withdrawal reflex, also known as the flexor reflex exercise. And that's it. We're then moving on to some active therapeutic exercises, which is dancing and wheelbarrow techniques, and these are great for patients with reduced hip extension.